I'm Dr Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. Have you been thinking about having dermal fillers or hyaluronic acid fillers, but you're worried about them? You're worried about how you're going to look. Is it safe? Is it painful? Am I going to come out looking like a weirdo? Well, stay tuned and I'll hopefully answer all your questions about hyaluronic acid dermal fillers. Keep tuned.
What are dermal fillers?
So dermal fillers, or what are often referred to as HA or hyaluronic acid fillers, are products that are injected usually into the face to treat or to restore loss of volume or to improve skin quality. And they're used widely now in aesthetic medicine for anti-aging and for maybe even changing the facial shape and profile.
What is a hyaluronic acid filler?
So hyaluronic acid fillers are based on hyaluronic acid. Now, hyaluronic acid is something that is produced by our skin and tissues, especially in the face, to retain moisture. And that's what keeps the hydration and the plumping of our skin. Unfortunately, we lose the ability to produce hyaluronic acid as part of the aging process as the skin ages. And hyaluronic acid fillers are based on hyaluronic acid, so we know it is what we call biocompatible. It's well tolerated when it's injected into the skin or into the facial tissues. And hyaluronic acid that we're using in our fillers is based on a laboratory-produced hyaluronic acid. Is produced by bacteria, and they are then produced into different gel compounds, which can be then injected into the tissues. And each of these hyaluronic acid fillers have different physical characteristics as to how much they volumize, how much they lift, and they're based on different types of gels. So we can utilize these gels known as hyaluronic acid or HA fillers in lots of ways when we're treating our patients.
What are the common areas of the face where dermal fillers are used?
So I'm using, and certainly in Skin Excellence Clinic, we're regularly using dermal fillers, and things have progressed over the years and we're often treating the whole face now. But the common areas that we're addressing may be volume loss in the temple area and around the eyes, especially the under eye area, which is referred to as the tear trough. Patients are often presenting with what they call dark circles or under eye hollow. So we're using fillers there. We have some very specific fillers that we can use very safely and effectively in the tear trough area. Common areas where we're using fillers, it would be in the mid-face where you lose volume and the cheeks flatten. So we may be augmenting the cheeks and the cheekbones and treating the nasolabial folds. But increasingly, we're treating the jawline with fillers. We're often elongating the jawline because in a lot of patients, there is what's called retrognathia. There is a shortening of the jawline, especially through the aging, which makes the shape of the face look rounder and exacerbates the laxity. So we're often placing fillers along the jawline, and that can be men and women that we could be using fillers. A common area where we're requested to treat is the lips. Now, this may be we're actually augmenting the lip in a younger patient who may have very small lips and wants more definition and more volume in the lip. But we have to be very careful with the lip not to over-volumize or change the shape of the lip. And it's a very skilled treatment to give natural results. A lot of my more mature patients are presenting with lip aging, atrophy of the lip, lengthening of the lip, especially the lines and wrinkles around the mouth of the lip, which we can treat very effectively with hyaluronic acid.
What is the meaning of full face rejuvenation?
So when we're talking about full face rejuvenation, and this is something we're increasingly doing in our clinic, we're actually looking at the patient and looking at the whole face and the aging process. And when we're particularly using dermal fillers, then we're treating often everywhere that needs treating. So that is likely to include in a lot of patients the upper face, the temple, the forehead area, around the eyes, the mid-face, and the jawline. So it's actually looking at the person as a whole, treating the whole face. And the reason for that is how we can get really natural looking results, because we're actually addressing all of those areas of the aging process, and we're treating them often with small amounts of fillers, but in all of those different areas to give a really natural, more rejuvenated, fresher version of yourself. Most of my patients are fearful of having a filler treatment and looking unnatural, looking done. And that's often when people are putting too much filler in one area of the face, maybe the cheeks or the lips, but for example. So full face rejuvenation is the way that we can really address this. And it takes a lot of skill from the practitioner, like myself, to have an understanding of the aging process and the anatomy, and actually treating in that sympathetic way.
Why are there so many people offering cheap price deals with dermal fillers?
There are many people now offering cheap price deals when it comes to fillers, and you may see on the high street in a lot of places, even non-medical places, beauticians and hairdressers are offering filler treatments. And they look like they're a bargain, but you're not comparing like for like. So when you come to Skin Excellence clinics and meeting one of our doctors or myself, then you're being treated by an expert. We will look and take a very detailed medical history. We'll be looking at your aging, we'll be examining you, and we will be planning an appropriate treatment plan with yourself as to how we can address those concerns and those needs you have. So you're buying into all of that expertise. When it comes to the treatment itself, then we only use the highest grade products that we're getting from pharmacies that we know are safe and effective. And there are a lot of products out there now flooding the market that often coming via the internet and the web that are not coming through official pharmacy channels. And these products are potentially dangerous, have often very short-term effects, and often cause a lot of side effects and severe complications in some cases. And then the practitioner who is offering the treatment or doing the treatments may have very little training, very little skill, may have very little understanding of the facial artery and the dangers of treatment, which anybody with a needle and a syringe and a filler, that's having a lethal weapon in my eyes. And there are increasing cases in non-medical clinics, especially, of blindness, of tissue damage, necrosis, chronic problems, severe harm patients coming to from unregulated use of dermal fillers in this country. So when you come to Skin Excellence clinics, you're assured of the highest levels of safety. We're CQC regulated, so Care Quality Commission regulated. We are very experienced practitioners, and certainly myself, I'm an international trainer and key opinion leader, having trained many, many doctors with dermal fillers over the years. And so you're having the highest, and there's a very high satisfaction rate when patients come to our clinics because they're getting quality, they're getting a safe, effective product, and the results they achieve are meeting their expectations, looking natural, effective, and long-lasting.